These videos have been developed for instructional purposes. For this reason, the nursing students and nursing instructor review the steps of the skills at the bedside. In actual nursing practice, you and your instructor should decide if this approach is appropriate for you.
Well, this is my nephew, Christopher.
He is really cute.
Good.
Thanks.
I think he's got your eyes.
Think so?
Oh, how old is he?
He was 2 on his birthday.
Oh, hi everybody.
You are?
Oh, he's precious.
Oh. All right, we need to put those away. Sorry.
Well, I'd like to talk to you guys a little bit about bowel elimination issues.
You mean enemas?
Yes, I do. I know. But this is another type of procedure that is important to maintain a professional, non-judgmental, and matter-of-fact tone when dealing with the patient. So let's practice here, okay? Now, when you talk with a patient about bowel elimination issues, it's important that you take steps to ensure the patient's privacy while promoting comfort and normalcy as much as possible. Now, cleansing enemas are one kind of enema. What can you tell me about cleansing enemas?
Well, there are large volume and small volume cleansing enemas.
That's right. Simply, cleansing enemas are given to remove feces from the colon. Now, there are a few tips you should know when giving a cleansing enema.
Like warming the solution and lubricating the rectal tube before insertion?
Exactly. Right. We should also assess for cramping, dizziness, or pain when administering the solution. Now, what is the difference between a large volume and small volume enema? Robert?
Well, one's large and one's small.
Meaning?
The volume's different.
Very good. Now, the administration process of small volume enemas is nearly identical to that of large volume enemas, with the exception of the solution volume, of course, and the packaging of the enema.
And after the administration, the patient should try to hold on to the solution as long as possible, right?
That's right. So, ladies, why don't you go about your patient care, and I'm going to go with Robert to see his first patient, all right?
Okay.
No problem.
Good luck.
See you guys later. Miss Swenson, my patient didn't get sufficient results with a small volume cleansing enema administered earlier, so his physician ordered a large volume cleansing enema to try and treat his constipation.
All right, well, why don't you gather your supplies, and we'll meet at the nurse's station, all right?
Okay, sounds good.
Thank you.
Hey, Mr. Whitfield. I have a different enema we discussed earlier. Is it okay to do it now?
Sure, fine.
This is my instructor, Miss Swenson. She'll be observing for a little bit. Is that okay with you?
She's going to watch?
Well, only if you're okay with it.
Oh, okay.
Well, just give me a moment. I'm going to go clean my hands.
How are you feeling?
Good.
Good.
Yeah.
I'm just going to stand in and observe.
Can I check your ID band?
Sure.
And can you tell me your name?
Bill Whitfield.
Thank you very much. Now, after I administer the enema, would you like some assistance to the bathroom, or would you rather use the commode?
I'd rather use the bathroom.
Okay, then. Do you have any questions before we begin?
Can you knock me out for this?
I'm sorry, Mr. Whitfield. I'll make it as fast and as easy as possible. This will help relieve your constipation and move your bowels.
All right, then.
Just give me a moment. Let's get some water.
It's nice to have something to do that, huh?
Okay, I'm ready. Just going to open the enema kit. Make sure that it's complete and not damaged. Okay. Make sure the clamp's all the way down here. Now I'll add any additives and the enema solution in the container.
How do you prime the tubing on the enema kit, Robert?
Well, first, I'm going to hang this on the IV pole. Then I'm going to unclamp the tube, and I'm going to let the solution run through the tube, and making the solution flow through the tube until all the air is removed from the tube, and then reclamp.
Good.
Just going to recap this. Put on my gloves. I'm just going to lower the head of the bed.
Okay.
There we go. Then I'm going to ask you to roll over to your left. And I'm just going to put the waterproof pad underneath you here. Just fix your gown a little bit.
Thank you.
Make sure the rest of you is covered.
How high is the solution container placed?
It should be placed about 18 inches above the patient.
Good. And why is that?
Couldn't the pressure instill the solution too rapidly and cause distension or excessive pressure in the intestine?
That's right.
Okay. Now I'm just going to lubricate 2 or 3 inches of the tube. There we are. Okay. Mr. Whitfield, you ready?
Can't wait.
Okay. Just take some slow, deep breaths.
Be sure to insert the tube only 3 to 4 inches and angle towards the navel.
Yes.
If you feel any resistance, infuse a small amount of solution into the rectal area, withdraw the tube slightly, and then proceed with the insertion.
Nope, it's fine.
Okay.
Go. Now just going to have the solution move slowly for about 5 to 10 minutes.
Continue to hold the tube to prevent it from slipping out.
Will do. Mr. Whitfield, you're doing great. You feel any cramping pain or dizziness?
No, I'm fine.
Okay. Now we've reached the desired amount. So I'm going to clamp the tubing and carefully remove the tube.
This is where I try to keep from bursting.
Exactly. Hold on 1 second. Okay. Now you're just going to hold the enema solution in.
Okay.
And take this tube and cover it with this paper towel. Very good, Mr. Whitfield. Now you need to retain the enema for as long as you can until the need to move your bowels is very strong. Then ring the bell and I'll help you to the bathroom, okay?
Okay.
You can lay back down on your back if you like. This may take 5 to 15 minutes. I won't be very far.
Thank you.
Now let me just dispose of the equipment. Okay, let's get you back to a comfortable position.
Thank you.
Tell me when.
That's good. Thank you.
Okay. Now here's your call bell. And if you need anything, I'll be right outside.
Okay, I'll be counting the seconds.
Thank you, Mr. Whitfield.
Thank you.
Good job, Robert. So what's the plan when he rings?
I'd help him to the bathroom. Then I'll make sure he has toiletries, washcloths, soap, and towelettes available.
And encourage the person to wash his hands.
Of course. Then I'll help him back to bed and record the procedure.
Be sure to include the character of the stool and the patient's response to the enema.
Okay, we'll do.
All right, see you in a little while.
See you.
Hi, Tamika.
Hi.
Did you tell me your patient was ordered a small volume enema?
Yes, he was. Are you able to do that with me now?
Sure.
Okay.
What's going on with the patient?
Well, he's been having trouble moving his bowels since having chest surgery several days ago. He hasn't obtained relief from the oral medications prescribed, so his doctor ordered a small volume cleansing enema to treat his constipation.
Okay. Let's confirm the order. Okay. Looks
Okay.
good. And let's gather these supplies and go see the patient.
Mr. Prescott? Good morning, Mr. Prescott. How are you? I have the enema prescribed for your constipation. Is it okay if we administer it now?
What happens if I say no? No, I'm fine. It's okay.
Okay, this is my instructor, Miss Swenson. Is it okay if she helps me with this?
Yes, follow me.
Okay,
How are you?
great.
I'm fine, thank you. How are you?
Good.
Good. You feeling all right today?
Good.
Good.
Okay, Miss Prescott, I just need to check your ID band. What is your name?
Melvin Prescott?
Okay, thank you. Would you prefer a commode, bathroom, or bedpan when we're finished?
Bathroom, definitely.
Okay, great. So we're just going to get this set up.
Now, like you said earlier, this is nearly identical setup to the large volume cleansing.
Okay. Miss Prescott, could you turn over to your left side, please? Good. Okay, I'm just going to put a waterproof pad underneath you. And slip through. Thank you. Okay. Okay, Mr. Prescott, we're just going to prepare the enema for insertion.
Okay.
You doing all right?
Yep.
Okay.
Great, thanks.
So did you grow up around here, Mr. Prescott?
No.
Where are you from?
I'm a New Yorker.
Oh. Okay, I'm going to need you to take a few deep breaths, okay?
Okay.
Okay, once in place, you can press the container with your hands to administer the solution.
You're doing great, Mr. Prescott. Okay, great. You're going to want to use your rectal muscles to hold in the fluid, okay? Okay, and I'll help you back. Good. I'm just going to go throw this out. I'll be right back.
Okay.
You doing all right?
Yes, thank
Okay.
you.
Good.
Yep.
You did great, Mr. Prescott. Now, I'm going to be just outside, so when he needs to use the restroom, just give me a buzz, and I'll help you, okay?
Well, I wish you could stay for a few minutes. I would feel better somewhere here with me.
Okay.
Well, why don't you stay here with him, Tamika? Great job. Thank you, Mr. Prescott.
Thank you very much.
Okay, so we'll just hang out, we'll chat.
Okay. Okay, I think I'm ready.
Okay, let's go. Okay, here we go. The sink and soap are there when you're done.
Thank you.
Looking good. How do you feel?
10 pounds lighter.
Great. Okay, we're just going to bed Mr. Prescott.
Okay.
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 Good. I'll be back to check in on you in a few minutes, okay?
Okay, then. Thank you so much for everything. I really
Okay.
appreciate all you've done for me.
No problem.
Thank you.
Okay.
All right.
So you're going to be doing ostomy today?
Yes, I am, and I have all my supplies right here.
Okay.
Ms. Swenson, I have a patient with an ostomy appliance. I was wondering what the appropriate action would be if it would leak.
Well, if an appliance leaks, it should be changed immediately. Don't attempt to repair it with tapes or other adhesives. Why shouldn't it be patched?
Because the stool can get trapped between the device and the skin, causing skin breakdown and infection.
Right. And the pouch should be emptied promptly to prevent leakage. What's the guideline for emptying?
Well, an ostomy bag should be emptied when it's about 1/3 to 1/2 full.
Exactly. If you two want to get started, I'll check in with you in a little bit.
Okay.
Thanks. Good luck.
Bye, Robert.
See you guys later.
Okay, Robert, are you on your way to see your patient?
Yes, I am. My patient is going home in a day or two after having surgery to remove a tumor. As a result of the surgery, she now has an ileostomy. Her nurse has been teaching her about her stoma and how to care for it. So her ostomy appliance is about half full, and I think it's a good time to empty it.
Okay. Now, if she's able and agreeable, this could take place in the bathroom at the toilet.
Okay, well, she prefers to stay in bed.
Okay, sounds good. Looks like you have your supplies, so let's go see the patient.
Let's do that. Mrs. Melrose?
Yes?
Hi, Mrs. Melrose.
Hi.
This is Miss Swenson, my instructor.
Hello, how are you?
Hi.
Now, I know your appliance is about half full, so I think it's a good time for us to empty it. Can we do that?
Sure.
Okay. Now, let me put on my gloves, and let me check your ID band, okay? All right, tell me your name.
Amanda Melrose.
Okay. Just going to put your bed up. Okay. Can I lift your sheets and your gown as well so I can put this waterproof pad underneath you? Okay. There we go. Thank you very much. I'm going to walk you through what I'm doing so you can get a review of the process. The next time you can do it and I can watch. How's that sound?
Like a plan.
Okay. Now, I'll hold the bottom end of the pouch and I'll make sure to lift it up and relieve it of pressure and make sure that the contents do not spill out.
Good. Now remove the closing clamp and fold the end of the pouch upwards like a cuff.
Okay. Got it. Now, I'll empty the contents inside the graduate container. Like so. Okay. Let me wipe the edge here to keep you clean here. Now take the squeeze bottle and rinse the inside of the pouch. There's no way. Okay. Now I take tissue paper and wipe the lower 2 inches of the pouch. There we go. And finally, I uncuff the edge of the pouch and I apply the clamp back on securely. There you go.
Thank
You're all
you.
set. Now, you need anything else?
No, I think I'm all set.
Okay.
Very good, Robert.
Let me cover you up over here.
Okay.
There you are.
Thank you.
You need anything else?
No, I think I'm all set.
Okay. Just give me a ring if you need anything.
I will.
See you later.
Bye.
Thank
Bye-bye.
you, Ms. Melrose.
Bye. Okay.
Hi, Jeannie.
Hi, Miss Swenson. I have to help a patient go over managing his ostomy appliance for when he's discharged. Do you think you could look in with me?
Of course. Okay. Now, you know, ostomy appliances are usually changed every 3 to 7 days, although this could be done more often.
Yeah, I need to remember to tell him that.
Okay. Well, it looks like you have all of your supplies, so let's gather them up and go see the patient.
Okay. Mr. Carlton.
Hi.
Hi. How you doing today, Mr. Carlton?
Good, thank you.
Okay, this is Miss Swenson, my instructor.
Hello.
She's going to be working with me for a while. Is that okay?
That's fine by me. But remember, call me Sean.
Okay, no problem, Sean. I'm going to look at your ID band and tell me your full name, please.
Sean Carlton.
Okay, Sean. Now, let's take a look at how we should go about changing your appliance. I can review it for you this time, and then you can show me how it's done. Is that all right?
Okay.
All right, great. I'm just going to get my supplies, including warm water, to wash around the stoma. Be right back. Okay, I've already washed my hands, so I'm just going to put my clean gloves on,
Okay.
and we'll get you in a comfortable position. Do you want to sit or lie down?
Lying down is good.
Okay, no problem. I'm just going to raise the bed a little bit so it's a comfortable level for me. Now I'm going to put a waterproof pad underneath of you.
Okay.
Okay, there you go. Okay, now to remove the appliance, we'll peel the adhesive from the top and keep the abdominal skin taut. That'll help with the removal. If there's any resistance, we'll use warm water or an adhesive solvent to help with removal.
Okay. All right.
There we go, right off. After removing the appliance, place it in the plastic bag for disposal. Now we use soap and warm water to wash around the stoma. Okay, nice and clean. Now I'll just pat the surrounding skin dry.
All right.
Now it's important to assess the stoma.
Really?
Yes. A pale stoma could mean anemia, and a blue or purple stoma could indicate compromised circulation.
What would I do then?
Well, you would just call your doctor if there were any signs or symptoms of infection or irritation to the surrounding skin.
Okay.
Now we'll apply the skin barrier around the stoma and allow it to dry completely. Then we'll take the measuring guide and measure the size of the stoma opening.
All right.
That looks just about right, 1 1/4.
All right.
Now we'll take the new appliance and we'll trace the same size opening on the back center. Now I'm going to cut the hole 1/8 of an inch larger than the actual stoma opening. Do you see what I'm doing?
An arts and crafts project? Does the skin need to be dry when you put the appliance on?
Yes, it has to be completely dry. If the skin's not completely dry, then the adhesive won't be able to stick, and then the appliance may leak.
And that wouldn't be good.
Not at all. So, remove the paper backing from the appliance and ease the pouch over the stoma. Get it all off here. Now we're going to press it onto the skin gently and smooth out the surface.
Okay.
Okay, Sean, remember the ostomy appliance should be changed every 3 to 7 days.
Okay.
Is everything clear? Do you have any questions?
Yeah, everything seems pretty straightforward.
Good.
Okay, I'm just snapping this pouch on. There we go. Seems secure. Okay. I'm going to hold it for 5 minutes.
Okay.
Are you comfortable?
Yes, I am.
Good. Okay. I'm just going to dispose of the used equipment.
Jeannie, when you document, be sure to include the appearance of the stoma, the condition of the skin, the characteristic of the drainage, and the patient's response to the treatment. You can also include any education you provided during the interaction.
Okay, that's not a problem.
Very well done. Thank you, Sean.
Yep.
I'm just going to pull this down.
All right.
Remember to ring if you need me.
Okay, I will.
And here he is with his brother.
Aw, they're so cute.
You're one of those people who never actually enjoy the day because you're too busy behind the camera.
Give them a break.
Okay, everyone. Good job today. I just wanted to answer any questions you might have.
Oh, I had a quick one. I was watching a nurse change a colostomy bag, and when she removed it and was washing around the stoma, there was some minor bleeding coming from the stoma. The nurse didn't seem to think it was unusual.
That's right. Finding a small amount of blood on the toilet tissue or the washcloth is a common finding during stoma care. Now, why is that?
Well, the stoma is actually a part of the intestinal tract that's brought through an opening in the abdominal wall. The GI tract contains a lot of small vessels that can be traumatized while cleaning or changing the appliance.
Very good, Jeannie. Now, remember that bleeding in larger quantities from the stoma or bleeding from the skin around the stoma or from the surgical incision would be considered significant findings. And those findings should be reported to the primary care provider immediately.
Well, how would we handle the patient in that case?
Well, you should reassure the patient, carefully pat the area dry, trying to avoid further trauma to the stoma, and apply the new appliance once the skin is completely dry. Any other concerns?
Well, I had an issue. After I removed the old appliance, feces continued to flow from the stoma. It made it almost impossible to clean and keep dry, so I could replace the appliance.
Again, this is also a common occurrence when changing ostomy appliances. How did you resolve the situation?
Well, I placed the gauze pad over the stoma opening to absorb any drainage while the skin is cleansed and dried. Then I removed the gauze pad just before applying the new appliance.
Good thinking. Now you can minimize the time between removal and replacement of the appliance by documenting the size of the opening cut into the appliance backing. The next time the appliance needs to be changed, the new appliance can be cut prior to starting the procedure.
Yeah.
Anything else?
Well, today I was administering a large volume cleansing enema, and the patient complained that he was having pain and cramping in the abdominal area. He said he was bloated.
Also common. Now, what would be an appropriate intervention based on those complaints?
Well, I would stop the flow of the solution for a few minutes, and I'd coach the patient, and I'd tell him to take deep breaths and just relax.
And once the pain subsides,
I'd start it again.
That's what we did.
did the symptoms return?
No. But if they had, I would have stopped the enema and discontinued the procedure. Then notified the primary care provider of the patient's symptoms.
Exactly. Anything else? Anyone? Okay then, great job today. I suggest we all get out of here rather quickly because the next shift is about to come on, and that's a whole crop of people who haven't seen Robert's pictures.
Hey, he's cute.
Tomorrow. And the world will know it, right?
Come on.
Come
You
on.
haven't even seen the pictures of him and I in Disney World.
Oh, thank goodness.
You want to see?
I'm pictured out. Thank you.
To me. Hold on, will you?